Welcome back, fighters. Your girl Shantae here, and do you like the new spots? I hope that's a yes because I really worked hard on it, okay? First, I'm going to apologize for not having posted any new content in over 2 weeks, and this is exactly why. I was looking at my videos and I said to myself, I didn't like where I was recording. I was just getting up, recording in the corner of my room, and I said, that's over with. So I started putting this place together. So I hope you guys like. Me and my friend, we are now in a whole different zone. I feel so much more comfortable. Now going forward, I will be posting my content again once a week. As a matter of fact, I'm going to shoot for twice a week now. So before we go any further, I need you guys to hit that subscribe button and comment. And as a matter of fact, I need you to do something even more important than that. I need you to share, send this to a friend and share this, post it, all right? Because one of my main goals in all of this is to spread awareness, and I really can't do that if you guys aren't spreading it. So I need you to hit that share button. All right, let's continue. I want to tell you what to expect, all right? I still can't believe it. That's what that pause was. I still freak out when I think about everything I went through. Expect a lot. And this is not to freak you out, but this is just to get you mentally ready. Expect a lot, okay? You are going to now need to find the doctors you're going to be with for the next couple of years because you are going to have a lot of them, all right? You're going to have your oncologist, your hematologist, your radiologist, your breast surgeon, your plastic doctor. I'm just naming the doctors that I had through my journey of it all, and those are just to name a few. As a matter of fact, I think I might have named them all. Yeah, I think I did. All of these doctors combined will make your team to help you fight this thing and then get you back to where you were, because your body is going to change. So accept that it's going to change, but don't you worry. The body is a healing machine. It will heal itself and return almost close to what it was before. Their goal is not to ruin you, but to cure you, take care of you, and then bring you back to the way you were. All right, so just to break down what each doctor does, because they all specialize in something. They all have their areas of expertise. The oncologist is the specialist who understands your cancer. All right, they know the ins and outs, what's good for it, what feeds it, what prevents it, what kills it. They're going to know the best way to attack this type of cancer because there's different routes to take. Some routes are better than others. Some routes are more invasive than others. It really just depends on you, the person you are, and what you hope to get out of it. And sometimes it even boils down to your beliefs and things like that. So your oncologist is going to help you figure out the best plan. You will have to make some lifestyle changes in regards to what type of cancer you have. So, but I can promise you, whatever those lifestyle changes are, they are always good to have in your life. So, no worries there. Now, the breast surgeon is the person who understands the breast in and out. You have the ductile nipples and so many other parts of the breast that I don't know. All I know is the breast and the nipple. Cover your ears. Okay, that's all I understand. But the breast surgeon is going to know the in and outs of your breast. He is going to let you know if the breast can be saved, what's the best route to take, because you have different types of surgeries that they'll not have to go into, look at the cancer, take out pieces of it, masses of it, and things like that. And he's going to say, what's the best way to do that? Can we save it? He's going to ask you, what is it you want to do? Because depending on what you want to do is going to be the next step. So that's what the breast surgeon is for. The plastics doctor is the one who understands reconstructing the breast. So whatever you do decide to do, if you decide to remove it, if you decide to just have part of it removed, he's going to figure out, he or she, I say he because my plastics doctor was a guy. In the beginning, it was not a guy. It was a girl. I'll tell you that story, too. God, I hated her. So, he will tell you the best route to take because there's different procedures you can do to rebuild or reconstruct the breast after going in and doing all these surgeries to bring it back to closest to normal as possible. So that's what the plastics doctor do. They reconstruct, and they know all the ins and outs of reconstructing skin grafts and everything. You name it, they know it. And they're amazing people. It's very interesting because you don't realize how intricate the body is and how it involves so many different specialists until you're going through something like that. So like when you think of the breast, for example, you don't just have the breast doctor, but you have like the reconstruction doctor. That person does not understand reconstruction. So it's crazy. But it's actually very interesting too. So then you have your radiologist. That's the person who, I don't know, they know radiology, they know radiation, they know how radiation affects certain cancers and what it's going to do to your skin, the right treatment. And this is after chemo, something you would do after chemo radiation. And you wouldn't consider radiation until after chemo is done, because radiation is a type of treatment that is helpful in lowering your chances of it coming back and returning. So some people may need radiation, some people may not, some may elect for it because they just want a peace of mind. They want to do everything possible to never ever have to see this cancer guy again. So, and then others is just like, I'll take my chances, because the effects of radiation can be really harsh. Actually, not can, it is really harsh on the skin. But I'll show you pictures of my time of radiation when the time comes. All right. And then your hematologist is the person who monitors your blood cells, your white blood cells, your red blood cells. They know all the ins and outs about blood cells. Isn't it crazy? Different doctors for different things. I never even heard of a hematologist until now. I've learned a lot through this experience, I must say. So now, what to expect? There are going to be a ton of tests and exams, okay? The doctors need to know what type of cancer you have and where is it? Did it spread? They now need to understand your type of cancer. So they need to do plenty of testing to figure that out. So you're going to have your MRIs, your mammograms, your PET scans, your CAT scans, your genetic testing. What am I missing here? Ultrasounds, bone scans. Wow, a lot. All of these exams or tests are important for them to figure this out. Now, first I'm going to break down these different types of tests. So I have my notes here to help me explain what each of the tests and exams that could possibly take place in your journey. So, for instance, the MRI. It's a sensitive examination which uses a powerful magnetic field and a computer to take detailed pictures of the breast tissue. That's what the MRI does. A dye is injected into your vein as a part of the scan, and this test can be used to help detect abnormalities not easily seen with like a mammogram or ultrasound. So what's a mammogram? It's an x-ray of the breast. Women already get this once a year, or they're, pushed to get it once a year after you hit a certain age. I think 40 is the age. So once a woman hits 40, that's when they're asked to do a mammogram once a year. And they say before 40, there's no need. But I'm living proof that that's incorrect. So if you can get a mammogram before 40, please do so. Because now I kind of wish I had. But as of right now, the American Cancer Association only deems it necessary for anyone under 40 to get a mammogram once a year if they have family history of cancer or breast cancer. But I say, tell the doctors you have a family history and get a mammogram anyways, because it literally can happen to anyone. So that's my advice to you. Go ahead and get that mammogram once a year anyways. Just tell the doctors, hey, it runs in my family. Make it up, because you can't go wrong getting tested. You could only go right, if that makes sense. So now we have an ultrasound. An ultrasound is a test that just uses waves to examine the breast tissue. In that, they can just look at different masks to see if it's hard, soft, filled with liquid. All right. Now, how they usually do that test is they just squeeze some petroleum jelly thing, which is always really, really cold, and just use this machine to kind of see through the layer of skin and see all the tissues in the breast. They're able to detect any mass in there, any masses in there, any lumps in there, that don't belong. Now, with that testing, I don't believe that they can figure out if it's benign or not. You got to learn some cancer talk because the doctors are going to be using this talk. And when they talk to you, they forget that you're not a medical student. So you don't know what benign mean or invasive means or malignant. You don't know what these words mean. So I'm here to teach you that as well. So now you know benign. So if it's benign, it is non-cancerous. And that's one testing that they can use. Then you have your MRIs, which is the big boys behind the ultrasound and the mammograms. All right. The MRI is a very sensitive examination that uses powerful magnetic fields and a computer to take detailed pictures of the breast. You have to be injected with a dye, and then the test can use that dye to detect any abnormalities not easily seen by the mammogram or the ultrasound. I did an MRI. It is loud and uncomfortable, but it's not harmful. Nothing you can't endure. You're just laying on your stomach. Your breasts are hanging out, and the machine is really loud. So they give you headphones to try to listen to some music to kind of get you to relax. Let me tell you what they did to me when I was doing my MRI. They forgot to put the music on, so I had to listen to all that crunching machine noise. And then when it was all over, they were like, how'd you like the music? I'm like, what music? You guys tortured me for an hour. So a bone scan. You'll need a bone scan because the doctors want to figure out how far it's spread. It is known for breast cancer to spread into the bones, all right? It goes outside the breast, outside the lymph nodes, and it will go into the bones. So bone scan is helpful to find how far this cancer has spread. And hopefully you found it in time and it has not spread into your bones. So the way the bone scan works, it is similar to MRI. You will be injected with a radioactive tracer, and then multiple pictures will be taken. In the pictures, if something lights up, your doctor will request extra x-rays. So the CT scan, it takes care of the lungs, the pelvis, the liver, all of your abdominal organs to make sure the cancer hasn't spread there either. In this test, you're laying flat on your back and you'll be in a big donut-like machine and you'll go in and out. This donut is wider than the MRI. So you're a lot less, claustrophobic in this machine because you're so close in the MRI. But this one is a lot wider and a lot less noisier than the MRI. The MRI is pretty noisy. And a contrast agent will be injected into your veins, and that's how they are able to see the tissues in the cells. The CAT scan only takes a few minutes, nowhere near as long as the MRI. So sometimes a doctor will recommend a PET scan along with a CT scan, depending on their findings. In order to get a PET scan, there needs to be a significant amount of disease present. That's how the PET scan works. And what happens in a PET scan is, again, you'll be injected with a sugar type of injection into the vein. And what happens is areas in the body that is rapidly growing, like tumors, will absorb the sugar and use the sugar as fuel, then making it light up. That's why you need a large amount of the disease to be present. So for me, I was going to get a PET scan. My doctor recommended it and my insurance declined it. At first, I was very, very upset because I wanted to take any steps whatsoever to catch any trace of this cancer in my body. I wanted to just take all the steps that any doctor recommended to me. So I was very upset with my insurance at first. They explained to me that there's just a small amount and it's not needed. And I was saying to myself, well, that's upsetting. What do you want me to have a foot long of a mass before you guys let me take a PET scan just to be certain that it's not in my lungs or anything like that? But I guess in the same voice, I should be happy that I don't need a PET scan because that means there isn't a large amount of disease found anywhere else. So a PET scan was just completely unnecessary. So now that I look at it, I look on the bright side, I'm like, ding, okay, I'm kind of glad I didn't have to take a PET scan. But once it lights up, the x-ray will find the abnormalities and be able to pinpoint it. that is all the information I'm going to torture you guys with for today. But I really wanted to elaborate on the fact that whatever doctor you're going with, make sure it's a doctor you like. You are going to be with them for a couple of years, especially your oncologist. You want someone who's going to understand you, who kind of listens to you, who maybe isn't biased to just their beliefs. Because in the medical field, doctors are, biased to their beliefs. So just to give an example, there was a time where I saw 2 oncologists. The first oncologist, she just was against women who's been diagnosed with breast cancer that feeds off of estrogen. She was completely against them having more kids. So I always wanted more kids. So I talked to her about, me having more kids possibly, and she was just like, no, you should not have kids. You are not going to have any kids. Do you want to be here? Her exact words. Do you want to be here for the kid that you have now, or do you want to take a chance and risk, leaving this earth to have more kids and risk it coming back? She was completely against it. Talking about kids just was not a topic me and her could ever talk about. She did not want to hear it. She wanted it to just completely leave my mind. But then I met another oncologist who, she had a different approach. Dr. Lake, she's amazing, by the way. Her take on having kids was, wait a little bit, fight this first. Wait maybe 5 years if you can, longer than that, and then let's discuss having kids. It's totally possible to have more kids. It's probably not the smartest to have more now, right at this moment, because you got to go through chemo, and then you want to make sure this cancer is gone before you increase your estrogen cells again, right? Because I have estrogen positive cancer, which means if I got pregnant, my estrogen levels will get higher, and then the possibility of it coming back would just be greater. You kind of want to just wait that out. So she just was enlightful about the fact of me possibly having more kids. So I loved her. She was very, direct with her answers, letting me know like, hey, not right now, but definitely something later to talk about. I love how she thought about me. So my advice to you is to get a doctor that understands you and your wishes and will try their best to help you live the life that you want to live. Because even though you are a patient, it's still your life to live. You know what I'm saying? It's still your life to live. So whatever steps you want to take, however you want to do it, make your decision and go forth with it. Another example is my plastics doctor. I hated her. I'm not going to say her name because the last thing I want to do is shame anyone. But I hated my original plastics doctor. She was just way too conservative for me. The procedure that I wanted to take, she was just always against doing. I think she just wanted to take the easy route and just, cut the breast and add in implants. And she just was not open to any ideas of using my own fat for reconstruction instead of putting in implants. She just wasn't nice. I didn't enjoy her. There were times I dreaded going to see her, and it shouldn't be like that when you go to see your doctors. And so the lesson to learn today is pick your doctors wisely, because you're going to be with them for a while. They're going to be like your new best friend. You're going to be reaching out to them. They're going to be reaching out to you. So, and get someone you can stand. You don't want to be stuck with someone that you can't stand. All right, guys, that is it for today. But before you go, please subscribe if you haven't already done so. Comment, DM me, and don't forget to share. Sharing is very important because we want to spread awareness. We really, really do. That is the goal. All right. I love you guys, and I'll see you next time as we fight this H.E.R too.